looking at list reconciliation, and if you could just explain to us what that is, please.
So list reconciliation is a data quality exercise where we compare the data on your clinical system and the data on ours or the spine. To begin a reconciliation, PCSE require a download that's produced from your clinical system. This is then sent to the spine for the comparison, and we send an email inviting this download and giving instruction on what we need to do. There are two different main discrepancies we're looking for during the list reconciliation process, and it's if the patients are registered on one system but not the other, so we need to correct that. But also if the patients have a discrepancy on their demographic data. So if our address is different on our system to your system, we need to correct that. The list reconciliation process is designed to ensure that the clinical systems and spine have matching data. They're reducing the clinical risk to the patients and ensuring that the practices are paid correctly for their registered population. GP practices are contractually obliged to support with this due to the importance of the process.
Thanks, Sally. Is there anything that the practice can do to support the benefit of this?
So firstly, you'll be invited by email using your main contact to download the reconciliation data from your clinical system. So we contain all the instructions within the email, and it needs to be done within 30 days of the request. PCSE will then upload the file, and it creates work items for us to work through. Our team will then process these and will correct any discrepancies that may have occurred. Following that, we'll send you an uploaded file that will have back to you via email that you need to upload into your clinical system. This must be uploaded as soon as possible to ensure that data integrity is maintained. Any reports that identify patients as not registered on your clinical system but are active on your practice on the spine and vice versa should be actioned in accordance with the guidance that we provide. We contain a lot of information in those emails, so please read them and action accordingly.